The provincial health minister made a stop in Terrace Thursday. Local representatives and leaders, including Skeena MLA Claire Rattay, welcomed her as she visited key health sites and met with Indigenous partners. CFTK-TV's Helen Asante shares more.
Her visit included stops in Kitimat and at the Seven Sisters Mental Health Facility and the First Nations Health Alliance, calling their welcoming and partnership essential to improving culturally safe care across northern communities.
It's incredibly important that people living in rural, remote, and Indigenous communities have access to care, and achieving more equitable access to care is a huge focus of me, my ministry, and of our government. And by working directly in partnership with First Nations through the First Nations Health Authority, we are building up a system of First Nations primary care initiative.
Following urgent calls from nurses about staffing shortages, rise in mental health and toxic drug pressures, the minister said it was mandatory to see first-hand gaps and progress in local health care.
One of the reasons why I came up to Kitimat and Terrace was to meet with First Nations and see firsthand some of the Indigenous-led primary care and mental health and substance use care that they are leading in this area. We know that this region has been particularly hard hit by the toxic drug crisis, and our government is so committed to building out a continuum of care for people, and it has to be done in partnership. And seeing Indigenous-led facilities like that are being developed by the Northern First Nations Alliances, it's just incredibly meaningful, and I know it's going to make a real difference in people's lives.
Adding that expanding access to mental health and addiction care remains a top priority for the province.
Ensuring that people have better access to healthcare is a top goal. And one of the ways we can do that is by using virtual technologies and apps and ways for people to access care, whether it's mental health and substance use care or using teledoc or virtual care options in clinics and in hospitals. We are seeing more of this being integrated into healthcare settings with a lot of success, and it is something that will continue to be working with First Nations and with rural and remote communities to develop more of, at the same time, while of course continuing to build up the number of nurses and doctors and allied healthcare workers, the people that deliver the care face-to-face that is always going to be so critically and vitally important.
CFTK-TV News, Helen Asante.